I'm Nancy Brown. I'm the practice administrator at the Veranda, and I'm here to talk to you today about patient-centered medical home and patient-centered specialty practice and what that means to us and to our community and to you as an individual patient. It's a transformation. It's not a buzzword in marketing. It's not something that you can say, I'm a patient-centered home. It's actually a designation. The National Committee on Quality Assurance issues the designation, and it's basically 3 levels of achievement, a level 1, a level 2, and their highest level 3. So I was really proud that the Veranda achieved level 3. And you get there based on very objective standards that they measure you against, and you have to submit evidence of what they consider to be evidence for patient-centered medical home. There's basically 175 factors that you have to pass, and of those there's some critical factors. But it's all about communication, and that's what gets me excited, because it's knowing, I feel confident as a patient that if I keep everybody updated as to who my care team is, that those care team members are constantly going to be getting information every time I'm seen here at the Veranda. It's also a method of trying to update information and look at things at overall outcomes, like I said. So we've invested heavily in communication resources, as well as exchange of information, databases, so that every laboratory value and information diagnostic that we receive is entered into your chart electronically as an individual element. And that can seem awfully boring, but at the same time I think it's really important, because it allows us to analyze the data overall. So we can look at information like your diagnosis and look at your laboratory results, and then we compare you and all of our patients together as a standard against National Quality Forum standards. And we can look at diabetics, for instance, and you can say one of the most constant things that Dr. Kyle likes to measure for is the hemoglobin A1C, so you know that you've got certain levels, and you try to keep those levels below 6 to avoid any kind of damage to your end organs, like your eyes or your lungs or your legs or vascular, kidney, anything of that nature. So when we're looking at it, we're trying to take all of our patients, all of our diabetic patients, and look at individually what they are, and look at as an aggregate what our average score is for patients with that diagnosis. And we're constantly trying to develop communication, again, individually with the patients, as far as educational resources, that we can bring people in office to do diabetic teaching classes, or we can send you information on websites or things when we find that you're outside of the norm, you're outside of where we need to be. Chronic disease is something that we all don't want to wake up and find ourselves that we have that at the end of the day. We want to be able to enjoy age and enjoy our children, our grandchildren, and not have to worry about a chronic disease process. And so the only way to do that is to really focus on health and wellness and how we compare to industry standards and health standards, so that we can make sure that we're keeping ourselves as healthy as we can be. And if we're intervening early, then naturally we're going to have better outcomes and be happy and healthier. We talk about our initial physician or provider care team, which could be a mid-level provider or it could be a physician. It's also your primary care, which is typically known as your internal medicine or family practice, or pediatrics, geriatrics, those type of physicians or providers. And it's also specialty providers. So it can be endocrinology and OBGYN, it can be surgeons, it can be oncology, it can be cardiology, pulmonology. Anyone that you also see outside of the Veranda is also part of your care team. So every time when you're coming through and you're updating your patient medical record, your triage should be asking you, who's on your care team? Is Dr. So-and-so still on your care team? Because that's our communication tool. That's on our face sheet. That's where we know exactly the go-to place where we know, okay, these people need to be updated and constantly sent the laboratory results and constantly sent updates on the progress notes and the medications and a summary of care documents, so that they know what we did on your visit here today, and they don't have to guess when you come back into their office as to where you stand, what medications were discontinued by the physicians, what new medications you were placed on. It's just that communication tool, again, that I think I'm so sold on, because that keeps me from having to have additional laboratory results run at the other practice, because they have the results that were done here. And vice versa. If they were done somewhere else, we've got those electronically updated, and we don't have to run them again. So to me, it's utilization savings, cost savings for the patients as well.